The model that I chose to do is the person-environment-occupation model. This model was first introduced in 1996 in the Canadian Journal of Occupational Therapy. At this point in occupational therapy history, occupational therapy had begun the development of theories of occupation that included models and frameworks. This was really a turning point since they no longer had to rely as much on people outside of the profession to guide their practice. The person-environment-occupation, or the PEO model, was created through ideas related to the life cycle, ecology, health communities, and environments. Since the development of the PEO, there have also been two models that have been created in relation to this model, and these are called the Canadian Model of Occupational Performance and the Canadian Model of Occupational Performance E. And these two models are very much closely linked to the PEO model. So the PEO model has 4 key domains, and these are the person, occupation, environment, and occupational performance. So you can see in this photo that there are 3 circles and they connect in the center to create occupational performance. So using this model helps to recognize the way that the 3 domains, person, occupation, and environment, come together to create occupational performance. So the first aspect that I looked at in the PEO model was the person. So a person is seen as someone who has many roles while engaging in various activities and occupations that are necessary or desired. The person is often seen as a combination of the physical self, the cognitive self, and the spiritual self. So these personal attributes are normally specific to this one person and as well as their life experiences. And this comes together to create one of the domains of this model called the person. So when looking at the person, we think of it as having 5 main components. And these are the physical, the cognitive, the sensory, the affective, and the spiritual. So the physical component is cell-to-skin movement, range of motion, strength, and tone. The cognitive component is thought, memory, reasoning, and judgment. The sensory component is touch, smell, sight, and hearing. The affective component is emotion and mood. And the spiritual component is the essence of self, religion, beliefs, internalized values, and many times the connections to something greater than yourself. So all of these components come together to create what we see as the person. So the second aspect of this model is the environment. And an environment is considered to be like the sum of what surrounds a person, such as the living things or natural forces. The environment is very complex because it not only involves the individual's direct contact with the environment, but also things around it, such as their home, their neighborhood, their community, and even further beyond that. And this is really important because previously, when occupational therapists looked at the environment, they just looked at somebody's direct environment. They didn't look at external factors like their home or their environment or their neighborhood. So this has been a turning point in OT. And the environment can be very impactful, whether this is positive or negative on the client. So there are 5 main components of the environment as well, and these are the physical, social, cultural, institutional, and virtual. Virtual has been more recently added to this list because the world has become more technologically advanced, so we have to take into consideration the virtual environment as well now. So the first environment is the physical, and this includes the natural and the built environment. Second is the social environment, and this includes groups such as friends, families, teams, intimate partners. The cultural environment includes things such as rituals, customs, foods, behaviors, and expectations. The institutional environment includes things such as governments and systems. And lastly, the virtual environment is technology and social networks. So the third aspect of the PEO model is occupation. And occupation is normally seen as the core of OT practice. Occupation can be extremely important to people and has been found to be effective in preventing diseases, increasing health and wellness, and is just like a basic human need that everybody needs. Occupations are often seen as meaningful activities that one needs or wants to partake in, and these often bring about fulfillment, social connections, joy, satisfaction, and self-expression. So when looking at occupations, we normally think of them in 8 main groups, and these are the activities of daily living, instrumental activities of daily living, rest and sleep, education, work, leisure, play, and social participation. So when talking about occupations, we can talk about them in 3 different things that build up to occupation. So it's normally task, activity, and then occupation. And there are two other things to consider when looking at occupations, and these are the temporal aspects and the occupational load. So the temporal aspect of occupation is just considering like time when looking at occupations, because this often plays a role in people's habits, patterns, and routines. And then occupational load is the number of roles, tasks, and occupations that an individual undertakes in a specific time frame, whether this is a week, a day, an hour, a year, however long it may be. And this is really important to consider for OTs because time and occupational load change as people go through like having a disease or going through an injury. So those are just really important things to consider when looking at a client. So the next one is occupational performance, and this is the last of the four categories of the PEO model. And this encompasses the person, the place, and the doing, which we can also call the person, the environment, and the occupation. So anytime that somebody is doing an activity in a place, you can consider that them having an occupational performance. So to maintain a well-balanced occupational performance, it's really important to understand how person, occupations, and environments shift over time and come together differently over time. So throughout the lifespan, they often change. And when an OT is looking at someone's occupational performance, it's really important to ask the client two questions: how he or she rates their performance in this activity, and two, how satisfied they are with their performance in this activity. So by looking at these two aspects, the therapist can really work with the client to create a mutually designed intervention. So as I said previously, the PEO model can change throughout life. So this is a model that can be used on almost any age person, like really above the age of 5. So throughout life, the three aspects, the person, the occupation, and the environment, often come together differently. So in these three diagrams, you can see the first one is what we consider early childhood. The second one is what we consider adolescence or middle childhood. And the third one is what we consider early adulthood. So in the first picture, in early childhood, you can see that the occupational performance circle is really big and it's really symmetrical. And this is often because a child's life is managed by an adult and everything is structured perfectly for them. So this makes for a very equal and balanced occupational performance. And then when we go to the second diagram and look at adolescence, the occupational performance really shrinks because they're starting to engage in risk-taking, testing roles, self-exploration. And this shrinks the occupational performance because they're having a less balanced life and their person, occupation, environment aren't fitting together as nicely. But then as we move into early adulthood, the occupational performance starts to grow again because at this point people have normally overcome all the things that they've faced in adolescence. So they're starting to achieve equilibrium and creating a more balanced life. And that causes their occupational performance to become more symmetrical again. So when the fit between the components are good, such as in the first diagram and the third diagram, the occupational performance is maximized. But then when the fit between the components is bad, such as in the second diagram, the occupational performance is minimized. So that's just a way to look at how the occupational performance and the PEO model changes throughout life. So the clinical use of the PEO model, this is a very fluid and flexible model, so it allows you to work with different models and frameworks. So in the original explanation of the model, you can, like when you're thinking about it clinically, you can look at it as there's 3 steps when you're using this model. You're first identifying occupational performance strengths and problems. Second, you're assessing the 3 components of the PEO, the person, the environment, and the occupation, and how they interact with each other to affect the person's occupational performance. And then third, you're working with the client to develop a plan, intervention, and goals for this client. And this is really a strength of the model because it can be used for virtually any client, as I said before. And it can be used in a variety of settings. So the overall findings of the PEO model, it creates a firm foundation for OTs to branch off of if the OT is choosing to stick with this model or if they're choosing to also work alongside other frameworks. This is a nice foundation to have. It can be used in a variety of settings. It can be used across the lifespan. It's client-centered, which is really important since occupational therapy, OTs are always trying to make their OT client-centered, so that's important. And it takes into consideration many aspects of life. So in an article that I read and I posted on Blackboard, they discussed the use of the PEO model specifically in an acute healthcare setting, and this is just a good example of how you could integrate the PEO model into occupational therapy. So they talked about how the OTs use this model, and they often feel that this is an extremely flexible model. It really helps them with communication, whether they're communicating with the patient's family, or other professions. They can use it to work alongside other models, and they can use it in varying amounts of depth. And these results were really in line with what the textbook stated that this model should be able to do. So I found that really important and interesting. And it really showed that this model can be used in real life settings. And these are just the other assignments and the sources.